We are the nationwide distributor of the MediRoth, and we're going to be talking about that device in exosomes today. Our company was founded in 2012. We work with aesthetic providers nationwide. We have consultants who represent our products nationwide. And aside from the Roth, we also sell a portfolio of devices commonly used for aesthetics, which you can see at our online shop. So if you like what you hear today, please reach out to the person who invited you. Or contact us at info@ppslasers.com, and we'll connect with you that way, or speak to your consultant who you're already working with. So today we are going to be discussing the MediRoth as well as exosomes, and we're going to do a live example today of how to do that. We have with us Master Trainer Gigi. We also have Mark Durrani, who is our biologics expert. And we are going to do a demonstration. Then we're going to talk a little bit about the return on investment with combining the two, microneedling RF plus exosomes. And we have a holiday promotion that we're going to give away today. Yay. And then we'll open it up to general questions and answers. And we're going to have a lot of fun. So without further ado, I'm going to introduce real quickly, or give a little bit of biography real quickly on our guest speakers today. We have Mark Durrani joining us, and Mark is the founder of Rise Up Medical. He's been in the aesthetic industry for over 20 years. PPS partnered with Rise Up, his company, in order to bring biologic products to our customers that are the absolute best in class. And Mark works with several labs across the US and has consolidated to creating a portfolio of biologic products that best serve our customers. So we're going to be pulling Mark into a lot more of these webinars next year, and we look forward to addressing all different applications of how aesthetic providers are using biologics in their practice right now. For more on just the partnership between PPS and Rise Up, you can go to ppslasers.com/cell therapy. We also have Master Trainer Gigi, who is joining us today, and she's a clinician with over 20 years experience as well, has trained hundreds, probably over thousands of providers across the country and internationally. She's manufacturer trained and certified on over 120 devices. She owns and runs 2 med spas of her own in California and Texas, and acts as our head clinical trainer at PPS Lasers, and lucky for us, trains everybody on this call. So these are going to be our guest speakers. And with that, I am going to turn it over to Gigi here.
Welcome. Thank you so much for joining us. So we're going to talk about the MediRoth this evening in RF microneedling. And for me, it's a huge asset to my practice. This particular one I really like because there's a lot of safety issues to it as well as efficacy. So at the end of the day, for me, it's one of the most popular procedures, the most result-driven procedures. So for me, it's a definite must to have in my practice. I love to use it in combination with other devices and with, of course, as Mark's going to speak on later, exosomes, what have you. You can go 0.5 millimeters to 3 millimeters depth-wise, and you shouldn't be any further than that depth, especially on the face. You can radiate to 4 because we all know you've got about half a millimeter to a full millimeter radiation of depth deeper than you do actually of what's programmed. So comfort-wise, the reason why I really like this one, and I can show you, is, let me grab this real quick. When we compete against different manufacturers, there's one key that was actually brought up on Plastic Surgeons Association the other day. And so we do have other people that are brand names that people come in and ask, and they'll say Morpheus, Profound, this, that, what have you. There's a million of them out there. I will tell you one thing about our technology that has saved a lot. If you're using a hammer technology, which is like a staple gun, it's like hitting, a staple gun up against the bone. It's very painful, and the force is so, so extreme that we aren't really sure when it hits that it's at 1.5 millimeters, which is, I never really supersede that depth on a face anyhow. But when you have an elevator technology such as this, and let me program it to so where you can see the needle come up, you can watch it go up nice and slow. I don't know if you can all see that. It just goes up nice and slow. It's not slamming, radiating against bone and causing, more discomfort. So for me, that's one of the reasons that, I'm a big fan. It's a lot easier to talk to your patients and saying, hey, let's do the completed 3 or 4 recommended treatments. If you have something, that's painful, they're not going to come back willingly to do it again. Also, Profound is another one that's a competitor. It also has the hammer technology, but it's on an angle the needles go in. So if you're getting someone who's rolling the tip against the skin and they roll it this way out, as practitioners, we have our days, we didn't have enough coffee, what have you. You're also going to rip the skin or tear more, which is not a great thing to do if you have angled needles going in. So for me, that's my preference. Safer way, just as much efficacy. You can only put what they say, so much lipstick on a pig. You call it what it is. A lot of it's the bells and whistles. Needles delivering energy are needles delivering energy. That's just it. Do we want to do it safer, more effective, and more comfortable? I'm in for that. And that's why I chose this particular one. I own a couple of them, 2 or 3 of them in my practices, and our results are amazing. So for me, this is a must. It's a go-to, and it's an easy recovery for people who maybe can't do the whole downtime with an Erbium or a CO2 or what have you, and they'll prefer this. But I do tend to stack this one a lot with my CO2s. So for great results, and then throw some exosomes with usually with the Medi Inject for Gen-6, we're going to be doing topically, but 9 times out of 10, I'm going to inject it with Medi Inject just to get it right where I want it. And the results, the recovery, everything, it's just a great booster for that. Mark's going to get to speak with you on that. So do we want to start procedure, Sheldon?
Absolutely. Let's get it going.
Okay. When I'm doing a bony prominence, like forehead or what have you, have it on 0, on a 0.5 millimeter, no further than a 1, because that's all bone there. So that's a little bit spicy. And then when I get to the areas where it's a little more soft tissue, like the cheek area, malar pad, what have you, I'll put it to about 1.5. We don't need to be any further. Like I was saying with the other competitors, I have a hard time with that, knowing that if I'm possibly deeper than 1.5 millimeters, guess what? I'm in an area where they're taking off the fat. If you want to take fat off my rear end, my legs, my everywhere else, go right ahead, not off my face. So I get a lot of people that have come in and said, I had Morpheus, I had this, I had that, done. And yes, it's great. I know it's a brand name, but people don't know what that means. If you wanted to tell them, as far as the competitive edge or ankle on it, well, do you want all that fat, all that stuff we're trying to plump up and add fillers and do all of that too? And now we're going to atrophy it, and you're going to come in and say my face is sagging and bagging? Probably not the look we're going for. So I tend to, make sure that when I'm on the face that I don't supersede 1.5 millimeters. Okay, here we go. So we're going to start with Shannon here. And so so I'm going to straight up perpendicular after I clean off her face. And when you're doing RF, you don't need to grind it in there. Like, we want it to be as comfortable as possible. But it doesn't take a whole lot of time. It's pretty easy. Once you numb them for about a half an hour, 45 minutes, you can bust through it pretty efficiently. So it doesn't take a ton of time, but the ROI on it is fabulous.
And Gigi, while we're going through this treatment now, you talked about Morpheus. I know that some of the other competitive devices that people have questions on, that I'm seeing in the chat here too, is maybe you could comment on Profound, Vivace versus MediRoth, and just your experience in training on the different devices.
So let's tell you some stories. We have a engineer friend who is an engineer for, I think it is 97% of the devices in the world, not just the United States, in the world. And so we wanted to see what we are up against as far as competition wise. And so he took off the back of the laser so we could see what was, of the device, and checked out what was under the hood, if you will. And it was supposed to be a 70 watt. This is an 80 watt. So we're just comparing oranges to oranges. And what happened was he pulled it off and he said, well, no wonder this is really comfortable. He goes, because it's supposed to be a 70 watt, but it has a splitter on it, which actually makes it 38.5 watts of the energy that's coming, that was actually being utilized. So these are all questions that, we should be asking. And is the FDA okay with that? Yes, they are, because right coming out of the port where the energy source is, it is 70 watts until it hits the splitter. So that was an issue. Profound is a hammer, plus it's angled, so tearing on the tissue. So as clinicians, we're here to, educate our clients, our patients, on why we want one over the other. Because people say, how do you compete? How do you convert your patients? I explain to them, hey, do you want the fat off your face? Probably not. We're trying to pick the skin up, right? Okay, well, then we don't want it, sagging. So we should do this, this, or that, and explain as practitioners what the competition is doing versus this. And that really means understanding your device, what's under the hood, as well as what everyone's doing in practices, and looking at the adverse effects of, the pros and cons of each one. So for me, it was a no-brainer with MediRaft. Why? Because I wasn't breaking the bank. It's very cost effective for a practitioner, which then passes on to the client. And safety measures and efficacy. There wasn't another, I didn't have to think too hard on that, because that's a win-win all the way around on, both sides of the fence. So that for me, and I don't know if anyone has any questions, they can go ahead and shoot them out. Because I know people get a lot of that, but I just have to remember, people don't know what they don't know. I had a physiology professor, best guy ever, said, you know what? The minute you think you know everything is the minute you know nothing. And, just because someone said or you heard, really do your homework. But for long-term effects, I do have a lot of, I will say, Profound patients and Morpheus patients that come in and said, hey, I was supposed to get this done. One was a rep friend of mine, and she had sometimes we have non-meds out there, and they don't quite understand, where the tissues and where it, separates and what have you. And so they go into their trainings, and it's meds and non-meds. It's both, I find out there. And then what happens is, more is better, because the rep said, hey, we can go 4 millimeters, we can go 8 millimeters, we can do all of this. And then they do it. And the bummer is then, unfortunately, the fat has atrophied, in the buccal fat area. They also say, hey, that's great. We have someone who wants to do that. But the problem with that is you need to tell your patient, hey, the alternative is sagging skin in that area. So
Right.
now I'm going to take this
So what
exosome.
you're,
Go ahead.
so Gigi, what you're saying is, if I'm hearing you right, is that you're achieving the results that you want to achieve. That somebody might come in and say, but I've heard this is better or that's better. So I guess the question is how are you
Yeah.
converting those patients if they feel like they've been sold on another brand name competitive device?
Education, when I break it down for them, there isn't anybody who's going to say, hey, apples to apples, oranges to oranges. Um, what I'm going to explain to them is here's your cost. This does the same thing. However, we can get an effective treatment, just as effective, but safer. Because here's where the problem is. And I explain it to them just like I would, a clinician, but I try and use some analogies, that are maybe a little bit more layperson friendly. And I go through that with them. And 9 times out of 10, they don't know what they don't know. But once you educate them, they're going to say, exactly, that sounds better to me. The price is better. The result is just as good, if not better. It's safer. What's not to love in my world? I don't have a problem. I've been using this device for how long now? She's like 8 years, 9 years. And I've never had an issue. We've loved the results. So at the end of the day, why would I, put myself in the poorhouse and put my patients in that little bit more of a danger zone, or not, not as good of a result because, we went a little deeper. And that way, I'm producing everything they need. I keep that client. They trust me because now I've educated them and tell them why they're doing what they're doing. And 9 times out of 10, they're okay with that.
Excellent. And maybe this is a good time to open it up to anybody else that might have some questions as it relates to the MediRock before we get into the exosomes. And so if you want to just throw questions into the chat, we'll pick those up, or if you want to just throw them out there, that works too. So we'll relay that on to Gigi.
Absolutely.
Here's one on just cost of tips too. I can tell you that these tips are about $50 per tip, and that's a pass-through cost to the patient. And in terms of industry, you'll find them at more like $75 to $125 each. So they're significantly less in terms of consumable costs. And maybe you could talk a little bit about the other hand pieces that are on the device too when you get a chance, Gigi.
Yeah. How do I forget that? We have another hand piece too, this one right here, that is it's just an RF tightening. So if I want to layer this and I use this one first, I can decrease the impedance zone and then hit the RF microneedling after. It's kind of like warming up the car before you drive it. That gives me actually a really, really good result. And then I also have a cooling handpiece on it. Do I use it a lot? I'll be honest, no. Kind of end of a rough day, I'll put the ice on my back. But I do find this, the estheticians, if I think I've gone too far, I might use it to cool down. But estheticians like to use it a lot when they're doing some cryo and some facials and what have you in their closing. Of course, because that's kind of the new thing now. So they like to use that handpiece a lot. But that's the other benefit is I'm getting other hand pieces that most of them are kind of single faceted, and it's just, one hand piece. So I can, generate new and more revenue with using the other hand pieces on top of it as add-ons as well.
Great.
So now what I'm going to do real quick is I'm going to start with some exosomes because we see how Shannon's face is pretty red right now. So now I'm going to go to the exosomes. Mark and chop here. This is my favorite. We're going to do it topically. Usually I would do it with MediInject too, because I really want to inject them, but for time's sake, we're going to do a little, and I have a little in here, and I just put them topically and massage them in there and let it do its thing, and you'll be able to see when Mark's done talking, probably you're going to see a significant reduction in Shannon's redness here.
Yeah, maybe Maeve could just scoot in a little bit on a tight shot so we can see the before you, because I don't think she can hear me on camera.
Scoot in a little bit, Maeve, and see how red all of this is. Okay, so I'm going to show you here a little bit later. It's already subsiding right here on the top. Okay, and then we'll have Mark tell everybody why that's happening.
That is awesome. I'm happy to do that.
Yeah.
Of course, just like Sheldon talked about before, we've all been in this industry for quite a while. So I'm up to 25 years now, and RF microneedling is one of the things that I did introduce to the country, when it first started. So I'm very familiar and excited about this kind of technology. And of course, I think the biggest part that you deal with is when you start doing a lot more deeper work with an RF microneedling device, you create a lot more points of inflammatory response. And so one of the great things that I think that exosomes bring to the equation that something like PRP or some of these other post serums have not is the anti-inflammatory effect, because you've got specific cytokine proteins that are very specific for reducing inflammation. And I think, Sheldon, you actually have in your presentation to be able to show a before and after picture, but we can get to that
Yes, so we'll
afterwards.
do
But
that. We'll do that right now. Let's just jump in
I don't want
here.
to take
So
anybody away from the Gigi shot, because that is that right
Of
there is top
course you
notch.
can. I'm going to finish up Shannon's neck and let everyone tell you how wonderful it is what you do, because Mark's got the good stuff in there.
Yeah.
No.
So
You know what? And go ahead, Sheldon.
we can go back to Gigi and the demonstration, but maybe you could just you should be able to see my screen there, right?
Oh, absolutely. And
Yeah,
I would
for
love
sure.
even for Gigi's interjection in some of this as well, because it's always great
Oh,
to take it
you
from
know
the
I
clinical
will.
perspective. Yeah, exactly.
You know I will, Mark.
What do you get when you get two loud mouths in a room like this? It's a fun time, right?
Right?
So, I think one of the things too, we talk about PRP, we talk about exosomes, PRP has done a fantastic job of kind of setting the stage for what's happening today, because PRP has been around for 10 years. We've all heard of the vampire facials. In some fashion, we've probably even built some sort of program utilizing PRP for post-care and trying to address a lot of the improving the results that are happening post these procedures. And I think one of the things that becomes very interesting is that when people start to understand PRP versus exosomes, they realize that PRP is only delivering maybe 10% of what exosomes are doing today. And one of the key elements that PRP is really driving is these anti-inflammatory, not the PRP, that exosomes are driving, that PRP is not, is this anti-inflammatory properties. And of course, I think as a practitioner, I used to own a med spa too, so I understand the importance of trying to get a person back to their natural self so they can start going out to dinner and start into the socialization aspects. And when you're doing PRP, a lot of times we see that, well, let's just take it from this perspective. If you did nothing, you might see 2, 3, 4 day recovery time. If you add PRP to it, you might see it in a 1, 2, maybe 3 day recovery time. When you're doing exosomes, we're talking hours. So these cytokines are these proteins that are playing to basically regulate the immune system down so that you can knock out the redness in the skin. That is one of the biggest things that exosomes have. But I think the other thing too, when you're looking at PRP, is it's age dependent. The one thing that nobody really talks about until now, where exosomes became a little bit more popular, is age-related issues or not age-related issues, but age as an issue when it comes to using it as a post-treatment. And that's because even PRP companies are starting to admit now that once you get over the age of 40, PRP really isn't your best friend any longer. And when it comes right down to it, how old are we when we start to do these sort of procedures? So a lot of us are all over 40, 50, 60 years old. And here we're using the best of the worst of us. Well, what's nice about exosomes right now is they're coming from mesenchymal stem cells at a time in life in which they are the richest, or in the richest state, to create incredible change. So when we look at this sort of stuff too, we also recognize that exosomes they're more of an alkaline type of product. So they do not create that acidic nature or that burning that some PRP patients can experience. And then I think the other part too is, we look at it from a business perspective, and that is 15 minutes of time is 15 minutes of time. When you add up the amount of PRP treatments that you're doing over the course of a week, and if you could save 15 minutes per procedure, that can bring hours back that you could actually be doing other high-level procedures to drive more revenue into the practice. So if we can take the blood draw element away, if we can take the need for a clinician who has to draw blood, if we can take away the elements in which a patient may become in dehydrated or you can't find their vein that particular day, these are all points in which we can lose revenue or have to push that revenue off. And where we're using exosomes in today's day and age, we're finding that I like to call it a thaw and draw type of procedure where you thaw it out,
Correct.
draw it up, and it's ready to use.
And we have a picture too, Mark, that I'm going to flash to as well while you're going through all
go
this.
for it. Absolutely. So that literally is using an RF microneedling technology, and this was before they were doing the exosomes, and you can see right there, 1 hour later after using the exosomes.
This is what I'm going to have Maeve pan over here because this is what Mark's talking about. So you can see how red Shannon's face. I started the exosomes first on her forehead. Look at the difference between the color of her forehead and the color of her cheek. She has a little bit of rosacea, Shannon does, but this right there is already far less pink than this is right here. And so that being said, that speaks to the healing process and what Mark's talking about. Perfect segue. Thanks, Shannon, for healing, right?
Yeah, exactly. So what's interesting in this particular photo here is the one on the side that says without exosomes. That was taken 24 hours after doing an RF microneedling procedure. You move to the right and you see what it looks like when you use exosomes immediately afterwards, and that was an hour later. So that's a substantial difference. And to me, I'm back out at dinner that night. I'm not trying to hide in the house. I'm not trying to hide from work or having to use a lot of cover-up makeup in order to hide what I've done. So, in this realm here, patients love this. They'll pay just for this state. Not even getting into the fact that it can literally increase results by 2 to 3 times more over PRP, but just the fact that it can drive them back to their normal way of life in a very quick fashion.
So if Mark, we have
a question about just in terms of getting into the FDA approval stuff of exosomes being used in facial aesthetics. Maybe you could comment on that too.
Yeah, so I think the key thing here to understand is that exosomes, there's no exosomes or biologic products that have actually been FDA approved to date. There are a lot of companies that are seeking some of those approvals, but most of the exosomes that are being used in facial aesthetics are being done topically under cosmetic usage, or when we're getting involved in more of the injection side, they're falling under a regulatory code called 361. And basically, that regulatory code 361 allows you to do injections as a tissue supplement, but there can be no claims made to it whatsoever. You have to kind of keep more on a cosmetic language, but you also have to work with companies to determine which is which, because some cell therapy products can be injected, other products have to be applied topically. One day we will see this process where these things will get FDA approved, but right now it's not necessary because the FDA has only laid down regulatory requirements.
And we had another question earlier about the auto inject, because a lot of you were on the webinar last month when we talked about the Med Inject, which you can go to theinject.com and see that webinar. And so Gigi mentioned earlier that this whole stacking technique, where instead of putting it on topically, she would use the Medi-Roff and then immediately follow it by using the auto injector.
Right.
So in terms of the regulatory bit of that, Mark, maybe you could comment of how that would work.
Yeah, it really is all about where the product is placed. The lab has to follow certain conditions and have to develop the biologic, products in a specific way to fit into the regulatory code 361. If they don't and they want to inject, that becomes a 351 product, in which companies then have to start seeking an FDA approval. Like I said, there are some companies that are already stepping down that route, including ours. And then there's others that right now the FDA looks at and says, hey, as long as you're using them in a topical based use, they can fall under the cosmetic realm, which basically you're used to doing cosmetic usage anyway, because if you look at the language you use for promoting your skincare products, that's the same category that topical exosomes are put in. And I was there during all the FDA, regulatory changes. And I'll just kind of give you an example, because we were working in the Medicare space as well, where we were doing injections with amniotic fluid, and then we were also using them in topical wound care type, aspects. When the regulations changed, the FDA looked at it and said, hey, look, this has a systemic or secretion type effect to it, which means that it could move away from an area. So in that fashion, we want to regulate it differently. Well, they took the injection side of things away. But if your amniotic fluid was a patch that you applied on top of a wound, the FDA said that was still permitted, and Medicare still reimburses for that. So it's all in the language. It's all in terms of how the
What you
product's
say.
manufactured and what you say.
Excellent.
Exactly.
Thank you. And then maybe
Right.
Gigi, we're going to flash back and segue here to getting back to the pricing that you're charging at Pure, and maybe you could just walk us through this next slide if you can see it, okay? And
Sure.
talk a little bit about how that works.
Okay, so average pricing, we always want to try and sell in the package, not because we're trying to, we want the efficacy there. We want them to see results, so I do it anywhere from 2 to 4 treatments every 4 to 6 weeks. And so your first, you're doing about $2,400 if you're doing, 4 times, in a 4 to 6 month period. 2 times, and the only time I really sell a one-timer, but it's usually generates from 600 to 800 depending on where you are per treatment, or for people that are on their maintenance, so now they're biannually or quarterly because they want to keep up their initial 4 treatments and make sure they're staying on top of things in their in their aesthetic care. I will typically use the 5 to 12 billion in the MediInject when I'm doing a procedure, and I stack the MediInject on top with the exosomes. Like I was saying, and I can probably put it in lay people's terms too, that you want to convey to your clients. It's like we got 2 cars. We have, our PRP, our Toyota. No offense to anybody. I had one before too. But in this analogy, it's going to get me from point A to B, yes. So is the Ferrari. Okay, well, my Toyota has 25, maybe growth factors. And like Mark said, it's someone my age. I don't even think we can call it that. It's, it's just there. It's not doing much. It looks pretty, but it's just not doing much. Or we can have the Ferrari, which more is better in this case, get there a result quicker, better, look better, and it's going to go faster and do more. Yeah, I at this point, I'm going to go with the Ferrari because that's about a 425, growth factors in that. And Mark can chime in if my analogy.
Well, no, but I mean, honestly, it's all about it's all about the experience, right? So,
right.
And that's honestly what it's doing. If you can drive better results, if you can reduce the inflammation, and you can do this in a fashion that's economical, it's a no-brainer for patients.
Yeah.
I've literally had clinicians come to me and say, I'm never going to be able to get rid of PRP because patients want that. But when you start literally having the conversation about, hey, look, 25 growth factors with PRP, 450 growth factors with exosomes, just that number alone, without even getting into all the other categories, starts to look significant to them. So when they start looking at the investment of, hey, I could spend $300 doing a PRP injection, or I could spend $400 doing an exosome injection, it becomes a very easy transitional conversation.
Right.
And,
So
we
Gigi,
follow in that kind of good, better, best category.
So Gigi, in your clinic, you're really trying to drive a patient towards the 4 treatment package just because it's going to render the best results. And then I'm assuming you're either using the 5 bill or 12 billion post, whether you're topically applying it or using the MedInject or auto injecting to inject it after the treatment. So this is what we're seeing on the highlighted slide here. And you can see the cost. You can see the cost varies on basically volume, how much you buy. And then from there, you can kind of,
I will tell you the best piece, and not to interrupt you, Sheldon, the best person to speak to this, and I'd say is practice manager in Orange County, California. She is the RF microneedling guru. And I mean, every time I look at the screen of appointments and things, I just kind of look at it and go, are you kidding me? And she can probably speak to, her name is Daniela Egbert. She's on here. And she's like the guru of RF microneedling.
And I will say that the MediRaf here in California in this particular practice is definitely what I would consider, I actually call it our workhorse. That is in business every single day, if not multiple times. We average on a normal month 15 to 20, but I will say if I were to look at the actual bookings right now, especially November, December,
you already passed it.
November.
You already passed that.
Yeah, November, December, January, February, March, I average 2 to 3 a day. So this thing never is shut down for more than an hour just to cool off. And Mark, I agree with you, especially in this practice, anyone over 40, there's no reason for them to do PRP. We do exosomes, Exovex for everybody over the age of 40. And I also agree, in our practice, sometimes if we have 47 appointments in a day and I'm running 2 practitioners, we don't have that extra time to do the blood draw, the spin, all of that. It is so much easier to do the Exovex. It's one of the easiest things to sell all day long. It just makes sense once you explain it. I certainly will never be doing PRP again myself. As far as the, it's true story, you know, the really, you know, we all want instant gratification. With the MediRaf, it is a little bit of a longer process. You do have to make that commitment, but I will say it's one of the easiest obstacles to overcome, truly, and especially with our competitors. And Gigi, I know you touched on a couple of them. We've had multiple clients in this office devastated at the fat atrophy in their faces, and we try everything from fillers to try to do more tightening with more microneedling for other purposes. It's really sad. And especially in Southern California, you know, this is a very competitive area. I feel like some of those competitors are actually more dangerous than anything because they're not used in maybe the correct way in the correct area of the body. So we see quite a bit of that where we're trying to fix what other practices,
Yeah.
maybe didn't
More
do.
is not
Well,
better.
you know what? I wanted to add to Daniela's
Excellent.
side there because, you know, when you're talking about what people are doing to the face, honestly, this whole needle length thing has been a competitive thing. It has nothing to do in terms of the facial rejuvenation because it's like somebody comes out and says, well, I have a 2 millimeter needle. And the next one says I have a 3. And then the next one says I'm a 4. Next thing you know, the needle's touching bone. It is, and it plays no role. And the reality is that all the research in skin rejuvenation has shown that between 1 millimeter and 1.5 millimeters is
1.5,
all
yeah.
that's necessary in order to get the job. And honestly, it's really between 0.5 and 1 millimeter because what you're really trying to address is UVA, UVB, and UVC damage. And that's what we're visually seeing. And this whole needle depth thing has been one of the most frustrating points for me in this industry because it means nothing and all it's doing is causing damage to the patient
Right.
because someone who doesn't know any better is putting that tool in their hand and doing something that could be irreversible. So that's why I like the MediRaf is the way.
I also wanted to mention that our average package here is about $3,200 because we do sell 4 and it's face and neck. And I have numerous repeat customers. It's what I choose to do for myself. Obviously, you know, knowing and using the products, the machines, that's the best sales tool you can have. And yeah, I think it rocks. I mean, I don't know what we do without it.
Well, thanks, Daniela. Thank you, Daniela.
She's really 89.
What?
You know what? I'd like to add one thing on top of
that.
that.
Great. She's really 89.
Yeah,
just
I was just
to-
throw that out there. I didn't know if it was appropriate.
Yeah.
just to keep it moving here, guys. So getting into what Daniela just spoke about, I mean, you said it was over 3,000 that you're charging for 4 treatments. So you can see on this slide, when we look at just conservatively at $2,600 for 4 treatments with a MediRaf or microneedling RF minus the device cost. If you're financing it, and we're not including the room costs, but you know, you're still looking at over about $1,300 profit. Then you add in the exosomes that Gigi just did on the patient. So that's another few $100. So you're looking at least a $1,600 profit if you have 1 treatment a month, assuming that package and a little exosome application after. Here we have the price of the MediRaf on special right now. So $6,000 discount for webinar attendees. And we're also doing a holiday promotion where if you want to get both the RAF and the MedInject, and again, you can see if you weren't on the MedInject webinar last month, you can go to theinject.com and watch that webinar and a bunch of other videos. But we're doing a special this month, which is about almost a $14,000 discount. That puts you at $74,000 for both devices, which is a payment around $1,800 a month. So there's a lot of reason to buy in 2023. You've got the Section 179 discount plus the discount we're offering today, and literally you're looking at one package sold a month to break even on your costs here. So that's how the ROI breaks down, the pricing of it breaks down. And I'm going to open it up to questions and comments and all that kind of stuff
And I'm
now,
gonna make
and
comment
turn it over to Gigi.
to Sheldon is here shortly. You guys will be getting an invite out where it's going to be Mark speaking heavily on exosomes with the MediInject, because Mark, you can tell just by the way this comes off at the tip of his tongue, as we do with devices. We've been in the industry for a long time. If anyone knew any more about exosomes and stem cell, it's this man right here. Personal experience. He has helped so many all over the country. I revere his advice and his research. Better than I've been through trainings of a million different companies, and Mark to date knows more than most of the physicians and is way more educated. So in order to really understand this whole thing that we're kind of navigating through with the FDA and everything, we're going to host a webinar that we're going to cut Mark loose, and you guys are going to be really appreciative of that.
Thank you for that plug, Gigi. That was good. We are recording that, right, Sheldon?
Yeah, that is recorded. So opening it up to any questions. I know a lot of you guys had questions that you threw in the chat, and we've addressed those. But anybody else want to unmute and fire away while we got everybody on the call? Go ahead.
Is there anything I didn't cover?
Can you go back to the pricing slide of the treatment?
Absolutely.
Thank you.
Sure. Miss Kim.
The pricing, patient pricing, correct?
Yes, thank you.
Correct. There you go.
And we will have this recorded and sent back out to everybody that's on the call. So you'll have an opportunity to get copies of all of this today.
Right.
Yep. If you missed anything. And I realize that a lot of us are kind of just going to listen to this after the actual live. I'm sorry. Was that enough, Kim, for me? Or did you did you have a question, or did you just want to write down some of that stuff?
Nope, I got it. Thank you.
Okay, you bet.
Kim will find me.
So I realize a lot of people might be joining us afterwards, after we've actually finished the production of this and are listening to the recorded version of this. And if you are, don't hesitate to reach out to any of us. We've got our company contact up there, the shop for all the devices. Mention the fact that you were on the webinar or listen to the recording of the webinar for the holidays discount. And of course, if you want to follow us on Instagram, or Gigi's handle on Instagram, it's right there. And everything is on our YouTube channel too. So we really appreciate everybody's attendance tonight. We realize it's gone a little bit longer than normal. And next year, we'll be following up with specific applications of, again, devices coupled with biologics, exosomes, that kind of stuff, and how Gigi is using that in her own practice. So with that being said, we just want to thank everybody for joining us, and have a wonderful evening.
Everyone have a Merry Christmas and enjoy it. We'll get back to you at the end of the year, or the new year, I should say. Gosh.